Vital signs are a specific set of objective data that indicate how well the body's vital organs, like the heart and lungs, are working. Blood pressure can be measured by an automatic cuff at home or using a manual inflation cuff and a stethoscope. A client with high blood pressure may not always experience any abnormal symptoms, or they might have headache, dizziness, or redness in the face. Clients with low blood pressure may have some symptoms. Common symptoms include pale skin, fatigue, weakness, dizziness, cool, clammy skin. Note changes from baseline and call your supervisor if appropriate. The pulse can be measured automatically with a finger probe, manually with radial pulse, or by listening to the chest with a stethoscope. Then count the beats for 1 minute, 60 full seconds, using a clock or watch with the second hand. Clients with a rapid heart rate might complain about a fluttering feeling, heart palpitations, faintness, or dizziness. Clients with a slow heart may also report faintness, dizziness, chest pain, shortness of breath, or confusion. Oxygen saturation can only be measured with an automatic finger probe. Nail polish or thickened fingernails can interfere with the sensor. If you need, try a different finger or an earlobe to get a good reading, or ask the client to remove nail polish from that finger. Some probes measure both oxygen saturation and pulse, so make sure you understand the difference between the two numbers. Clients with a low oxygen saturation may display paleness, fatigue, weakness, dizziness, shortness of breath, confusion, or clammy skin. To get your client's respiratory rate, count the number of breaths they take in 60 seconds. A breath consists of an inhalation and exhalation. Clients who have a high respiratory rate are hyperventilating. Clients with congestive heart failure or respiratory illness, or those experiencing anxiety or panic may also hyperventilate. They may take louder or gasping breaths, and they may seem more anxious from the feeling of shortness of breath. Hypoventilation is when a client breathes too slowly. They're also at risk for not getting enough oxygen and may appear fatigued, weak, pale, and confused. There are lots of different kinds of thermometers for measuring your client's temperature. A client with a high temperature may feel warm to the touch and may experience sweating or chills. A client with a low temperature may feel cold to the touch and may report feeling fatigued, weak, or confused. Remember, if there are any new or concerning changes in your client's condition, contact your supervisor. If the changes are severe, call 911.